So I hope I can share some interesting facts about diet and prostate cancer, and really why we care about healthy lifestyle and prostate cancer. And I think, especially most of what we've been discussing here relates to patients with localized disease, and these patients are much more likely to die of cardiovascular disease than of their prostate cancer. So we have their attention, and we should use it to make positive changes that can actually extend their life. Honestly, some of these people, if I never called them back about their PSA for the rest of their life, they might actually do better. But if I take that opportunity to help them to reduce their overall morbidity and mortality, that is really powerful. Now, interestingly, even for metastatic disease, not everybody dies of prostate cancer. In fact, they estimate about 17% die from non-cancer causes, most commonly also cardiovascular disease, and certainly, significant cardiovascular morbidity associated with the management of advanced prostate cancer. So suffice it to say, I think we really care about this kind of across the spectrum of disease. Not to mention that cardiovascular health is also linked with other things that we care about a lot, like erections. So earlier, actually at the end of last year, I became board certified also in lifestyle medicine, just to really get more understanding and knowledge about how to integrate these lifestyle modifications into clinical practice. So just as like a basic introduction, lifestyle medicine really is broken down into 6 pillars that are the focus, which are whole food, plant predominant nutrition. So that's what we'll be talking about in this talk, since we're focusing on nutrition today, but also extremely important and interrelated are physical activity, restorative sleep, avoidance of toxic substances, so things like cigarettes, social connection and positive psychology, which is associated with longevity and certainly very important in the cancer population, as well as stress management. So all of these are so important, and I wish we had time to discuss more. But, now moving on just to the nutrition aspect specifically. So certainly this has come to light in some of these historical studies where people who are from lower risk countries like Japan, when they move to the US, the longer they are in this country, the higher their risk of prostate cancer becomes. So you wonder, what is it that happens when they get here? And a lot of it is the standard American diet. And if you look at the acronym, it's SAD, because it is so sad what it does to the body. So let's just ask an audience question. Maybe we could just do a show of hands for fun, okay? So which of the following of these is considered a group 1 carcinogen, means causes cancer in humans by the World Health Organization? Is it asbestos, smoking, processed meat? How about all of the above? Okay, you guys are good. Yes, so indeed, for some reason it's not written on the package labels like with cigarettes, but actually processed meats. Some of these very tasty things like hot dogs, sausage, bacon, salami are in fact considered group 1 carcinogens, right there with smoking, asbestos, etc. And then group 2A carcinogens include other red meats. So we're talking about things like beef, pork, and lamb. These are considered probably causes cancer by the World Health Organization. Which happens to be the same category as DDT, lead, and mustard gas. So I think really not what we want to be recommending as, physicians managing cancer. Why meat is carcinogenic, lots of different factors here. Some of it is some of these chemicals that are formed during the high temperature cooking process, but then there are also sort of inherent qualities as well, including hormonal effects like changes in the IGF-1 axis, and just the nutrient composition. If you're eating things like plant foods, that is the only source of fiber, whereas that's not found in animal-based foods. Now, another concern is dairy, and so quite a number of studies that link dairy to an increased risk of prostate cancer. This is like a very well-done study out of the Adventist Health Study, which is a large prospective study from the United States, and dairy consumption statistically significant very robust associations with the risk of prostate cancer and advanced disease, but there was no association with non-dairy calcium intake. So definitely, for things that we treat as urologists, like kidney stones, very important that people do get their normal calcium intake, but there are many good non-dairy sources of calcium as well. And also, dairy products, in particular whole milk, have been linked with the progression of prostate cancer in patients who are already diagnosed with the disease. So if we think about specific foods that have been linked with benefits to prostate cancer, these include things like tomatoes, cruciferous vegetables, nuts, soy, and then we think about the foods that have been associated with a higher risk of the disease or of progression, like meat and dairy, and we put this all together since nobody just eats one food. What we're really talking about here are these plant predominant dietary patterns. So I personally recommend, as the ideal, a whole foods plant-based diet. This is not Whole Foods, the grocery store. This is whole foods, meaning whole unprocessed foods. So the goal here is really to minimize animal products and to minimize processed foods. So the staples here really are legumes, fruits, vegetables, and whole grains. Now, it's important to note, because people seem to express a lot of concerns about this, can people be on a plant-based diet? Are they going to get adequate nutrients? Is it safe in different stages of life, like older adults? And in fact, this is the position statement from the Academy of Nutrition and Dietetics, discussing how not only are they nutritionally adequate, but even offer many health benefits at all stages of life. So in addition to some of these very well-established health benefits, including level 1 evidence in cardiovascular disease, for weight loss, diabetes, etc., plant-based diets are also more environmentally sustainable, and certainly obviously better for the animals. So focusing then specifically on prostate cancer, there fortunately have been a lot of studies on this really across the spectrum of disease, all the way from people who are at risk for prostate cancer to the incidence of prostate cancer, and then people who already have the disease. So I'll just show you a sampling of some of these studies here. So for example, this is a study out of University of Miami looking at the National Health and Nutrition Examination Survey, where people who consumed more healthy plant-based food had a significantly lower probability of having an elevated PSA in the first place. This is a study that we did, a prospective study using data from the Health Professionals Follow-Up Study, where they did serial dietary questionnaires over and over again, and we linked those with the risk of people subsequently developing fatal prostate cancer, and indeed found that people with greater plant-based and lower animal-based consumption had a 19% lower risk of fatal prostate cancer after adjusting for other factors. We also did a systematic review on strictly plant-based diets. This is vegetarian or vegan diets and prostate cancer. And here we identified 5 interventional studies that have looked at this. And so one of these is a randomized control trial, the prostate cancer lifestyle trial. And in this randomized trial, this was patients with favorable risk prostate cancer on active surveillance. So, similar kind of population to some of the people we may be thinking about in the focal therapy space. And they randomized them to an intensive lifestyle program where they had a vegan diet with aerobic physical activity, stress management, and supplements versus a control group. And the people in this intensive lifestyle program had a significantly lower risk of progression to treatment, but also many other health benefits, like a dramatic decrease in their reduction and many other improvements in their overall nutrition, weight loss, etc. There have also been clinical trials in the space of biochemical recurrence. So these are patients with rising PSAs after treatment, where those who were adherent with the plant-based diet, the PSA doubling time started to level off, or in some cases even go down. Importantly, in the systematic review, we did not find any studies where there was evidence of harm. So I think in context of the many other benefits of these dietary patterns, this is very good news. Certainly, an added perk is that they have been associated with a reduced risk of erectile dysfunction, and this is in patients without prostate cancer. So we really weren't sure. What about patients who have already had treatment for prostate cancer? Because here, you already have all these same things going on like atherosclerosis, but now you have the added injury of, potentially damage to the nerves from surgery or radiation. But impressively, we actually still found that even in patients with prostate cancer who had already had treatment, that those who consumed more plant-based and less animal-based food had significantly better scores for erections as well as urinary symptoms and hormonal symptoms. And then, it's worth mentioning just to consider kind of the global context as we think about all these hurricanes and everything else that's been going on, the climate impact of food. And, of course, things like beef and these animal products are certainly the most damaging in terms of greenhouse gas emissions. Similarly, dairy has a much higher footprint than any kind of plant-based milk alternative. If you look at really any environmental metric, land use, water use, greenhouse gas emissions, etc. So we've written a few papers on this trying to, really zoom out and just think about more holistically how shifting towards plant-based diets, thankfully, can it benefit many different things. We can have improvements in overall health with all of these well-established benefits for cardiovascular health. Also, some of these, very promising data showing associations with a lower risk of fatal prostate cancer and associations with better erectile function, and simultaneously being more friendly for the environment. So conclusion, pretty simple. Eat more plants, associated with a lower risk of prostate cancer progression, better scores for quality of life, but also better for cardiovascular health and the environment, emphasizing whole, minimally processed foods. So here's some resources if anyone found this convincing and want to share this with your patients. Some very interesting documentaries available on Netflix, etc. There's some great books out there. How Not to Die was a New York Times bestseller. I refer a lot of patients to these virtual jumpstart programs that are available online, where they actually have registered dietitians and health coaches to help people implement this. Purple Carrot is a very nice meal service that's available in the United States. The Physicians Committee for Responsible Medicine, this is a group of over 10,000 physicians, as well as other health professionals, so a lot of great resources here for physicians and recipes. Nutritionfacts.org is another physician-curated website with evidence-based nutrition content. And finally, Happy Cow is a website and app where you can find plant-based food anywhere in the world. So the way things are these days, it's just much easier than it used to be. So I'd like to thank the groups that supported some of our research on this. And if anyone is interested in pursuing this further, you can certainly check out the American College of Lifestyle Medicine if you might want to consider getting this additional certification. And I'm happy to chat with anyone in the audience. Thanks so much.
Thank you, Stacy, and thank you for championing this. This is wonderful. I've been very passionate about this for most of my career and actually have a program called Active Holistic Surveillance for patients that have low-risk disease that are going on surveillance and just say, well, instead of just come back and see me in 6 months, we have a diet, we have different herbs that have anti-inflammatory, because clearly if we reduce inflammation in the body by taking plant-based diet, reducing red meat, reducing dairy, increasing exercise, you reduce inflammation and and your PSA stays stable and goes down. Nothing is more frustrating to me than seeing a guy with 5% Gleason 6, one core, who's panicked and whose BMI is 35, and he's smoking and he's hypertensive and his hemoglobin A1C is 10. And you're like, are you kidding me? This is what you're worried about, the Gleason 6? No, you need to get your life under control, and your diet needs to be under control. So I just
Yes.
wanted to say, thank you very much. And
Well,
there
you know,
are a number of different herbs which you didn't really mention, but turmeric, green tea,
yes.
scutellaria, holy basil, that have been looked at, that really, both in the laboratory and clinically, that can reduce inflammation and stabilize and even reduce PSA. So
Yeah, no, great
thank
comment,
you.
and certainly, you know, I think we could probably spend an hour with even the more detailed recommendations. I'm a big fan of turmeric as well, but you know, right back at you. I mean, I think I'm late to the party, but trying to catch up. But you've been doing this for years now, and you know, I bet you've saved so many more people's lives than most urologists due to your focus on this. So thanks to you.
Great. Thanks, Stacy. I'd like to apologize to the room for the lunch we served today. We'll do better next time. Stacy, what do you tell, like when a patient leaves, is there something that is it a packet you give to them? Do you just direct them to a website with resources? Do you have a well-prepped page where you can just say, hey, you know, that's a great question. You kind of tell them the foundation that you tell them, but then you have resources that you can give them that's well summarized, that maybe that we could utilize as practitioners as well.
Yeah, great point. So actually, I'm in the process of trying to get together a working group of people that are interested in this to pool together, and maybe Aaron will help, you know, and just to make some resources that we could share like this, because I think a well-prepped page or something that everyone could send out for the time being, you know, there are like great handouts available, for example, from the American College of Lifestyle Medicine with recommendations for each of the pillars. And I will sometimes help patients to get signed up for one of the virtual jumpstart programs and things like that. But I agree with you. I'm a big, you know, I'm really a health communications researcher, and I do think that tailored information is, you know, definitely the most powerful. So if it was, instead of these generic recommendations, if we had some sheets that were very much specific to prostate cancer and not just the generic handouts, that would be so much better. So that if anyone else is interested in working with me on this, it's just Stacy Loeb at Gmail.
Yeah, thanks for your talk. Obviously, I think you are a proponent of a plant-based diet. There is also competing, data on ketogenic diet, as long as you take out the processed part of it, with high fat or low carb and low insulin resistance. So, do you have enough data to say now that you should only do plant-based and should not look at other options? Because there is enough data out there to say. So, I'm just curious on your thoughts. Thanks.
Yes, so very good question. I mean, I think there are a lot of, concerning health factors with the ketogenic diet in terms of, the long-term impact for, cardiovascular health. So I personally don't recommend that to patients. Definitely, it can be extremely effective as a short-term solution for weight loss, but I think that is at the potential jeopardy of long-term health issues.
I think I spend about a third of my time talking to patients about cardiovascular disease, being a general urologist. And one of the things is we do a lot of testosterone management. Do you mind making a comment? Because a lot of men just want their testosterone. And although there's probably weak correlation between testosterone administration and prostate cancer as well as cardiovascular disease, I feel, though, that we're just kind of throwing testosterone at patients and we're doing a disservice to them. So do you mind making a comment about that?
About like the relationship between testosterone and prostate cancer?
Yes, and
I
health
mean,
in general.
in our study, we looked at this in the Swedish National Registry, and actually, like, we found that patients on testosterone replacement therapy were actually in the long term at a significantly lower risk of an aggressive prostate cancer. And so there's certainly, this relationship between low testosterone and the ability for a prostate cancer to grow in this low testosterone environment seems to be this more aggressive phenotype. And so by, appropriately replacing testosterone in patients who are actually hypogonadal, I believe is safe and appropriate and does not increase and may even decrease the risk of an aggressive prostate cancer. That being said, there are certainly documented studies with a lot of patients getting testosterone without the appropriate, biochemical evaluation, and that is certainly highly concerning.
What about testosterone replacement in patients who just won't lose weight and won't adhere to any lifestyle changes? That's a problem. That's a problem I see, though.
Yeah. Yeah, no, I mean, I think it's a tough situation for sure. I don't know. Aaron, do you have any comments?
Yeah, I think this is clearly a hot topic these days. If it's someone like that, I would obviously get a baseline testosterone because a lot of guys tell me that they're sluggish, they can't get out of bed, they want to, and they feel it's testosterone and it's not. And some guys are at maybe 250 or 150 and they're doing fine. And other guys just can't get off the bed at 150 and they need the replacement. So I think we do. I think you bring up some excellent points and we need to be really mindful about who we're replacing. And when we replace, we also be mindful as to watching their CBCs. I've seen a number of guys where their hemoglobins go a little bit too high. Guys that are injecting themselves at home and they're getting their testosterone up to 1200 and it's way too high. Their CBCs go off the chart, and you have to be concerned, obviously, about their PSA. So I think we do need to be mindful about it. But I think overall, it does seem to be helpful.